Nigeria records 10 fatalities as NCDC reports 397 new cases of coronavirus infections. Federal government National Assembly consider UK-US flights ban next week. In international news, Brazil's coronavirus death toll nears 200,000. And in sport, Roger Federer to miss Australian Open.
This is ANN News.
I am Olajumoke Olatuji. Nigeria has recorded 10 more COVID-19 deaths in the last 24 hours, with an additional 397 new infections, one of the lowest daily figures this month. In the past 10 days, there have been 52 recorded deaths from the coronavirus. The new cases were found in 18 states, including the Federal Capital Territory. Lagos reported 144. 6 states recorded cases in double digits. 11 others chopped cases in single digits. With the latest figure, the country's total infections now stand at 84,811. Since early this month, there has been a spike in coronavirus cases, and health experts blame this on the flagrant disregard for safety precautions. More than 71,000 patients have been discharged from hospitals after treatment in various isolation centers across the country. With the country entering the second wave of the pandemic, federal authorities have ordered the reopening of all isolation and treatment centers. The Nigerian government has also reintroduced new restrictions to check the spread of the virus, including closure of bars and nightclubs and limiting the number of persons allowed in a public gathering. The federal government also says it expects to receive in January one of the vaccines developed globally for COVID-19. So far, Nigeria has tested more than 910,000 persons. The federal government is considering plans to ban incoming flights from the United Kingdom and the United States of America because of the high rates of COVID-19 infections in those countries. Chairman of the Senate Committee on Aviation, Senator Smart Adeyemi, says a final decision will be announced next week. President of the Nigerian Medical Association, Professor Innocent Uja, had earlier warned the government about evidence showing travelers from the UK and the US were worsening COVID-19 cases in Nigeria. The PTF also opened registers for travelers from the two countries because of deadlier strains of coronavirus discovered there. Lagos State Governor Babajide Sanwo-Olu has commissioned a permanent triage and oxygen therapy center at Etiosa local government to provide swift emergency oxygen therapy to residents. The facility that also doubles as a COVID-19 sample collection center is located within the premises of the Etiosa Maternal and Child Care Center. The governor says this was important at this crucial time when the state is recording an increase in the number of persons experiencing difficulty in breathing and requiring urgent oxygen therapy. Sanwo-Olu says with this, citizens requiring oxygen therapy would not have to travel a long distance to mainland infectious disease hospital to access care. He said other permanent triage and oxygen therapy centers located in Alimosho, Isolo, Surulere, Lagada, Ifakwa-Ijaye, Ibejuleki, Apapa, Mushi, and Amuwo-Odofin areas of the state are almost completed and would be activated in 2 weeks. The University of Benin, UNIBEN, has been made a hub for traditional and alternative medicine supervision in Nigeria. This development followed an initiative by the federal government to coordinate a homegrown solution to health challenges with quality assurance and standard with a view to addressing decisively specific diseases through quality research. Minister of Health, Dr.
We are on the road every day, canvassing throughout Africa for news you really need. We follow the story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you'll need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, African News Network. We do news right in a truly African spirit.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
We apologize for the break-in transmission. The University of Benin, UNIBEN, has been made a hub for traditional and alternative medicine supervision in Nigeria. This development followed an initiative by the federal government to coordinate a homegrown solution to health challenges with quality assurance and standard with a view to addressing decisively specific diseases through quality research. Minister of Health, Dr. Osage Hanere, inaugurated an expert committee for the establishment of a National Institute of Traditional Complementary and Alternative Medicine in Abuja. Director, Media and Public Relations of the Federal Ministry of Health, Olujimi Oyetomi, announced this in a press statement. Dr. Hanere said this followed an urgency and now imperative for Nigerians and health authorities to devise local and effective solutions to the pandemic. Civil rights activist Ibrahim Garba Mariam has raided Hizbah operating in some states in northern Nigeria. He alleged this outfit is being used by politicians to oppress underprivileged people. Garba said Hizbah was primarily inaugurated to settle disputes in marriages, such as divorce cases in the region. He condemned some of the actions of Hizbah against people in the north, such as arresting people for improper dressing and destroying alcoholic beverages. Garba says even the application of Sharia law in the north has been overtaken by overzealous religious individuals. Garba pointed out that the law is not binding on non-Muslims, even if they reside in the region, because Nigeria is a secular country. He further alleged that the government is using Hizbah to steal. Christian Association of Nigeria, Osogbo Chapter, is asking for a reversal of the ban on crossover services announced by Governor Gbega Oyetola. Osun State CAN Chairman Bishop Amos Ogunride hinted that the leadership of the association is making all efforts to convince the governor that the services will be done with all adherence to safety precautions and health guidelines. The state's government announced on Sunday the banning of countdown to New Year ceremonies and crossover services to curtail a further spread of the COVID-19 infections in the state. The governor also directed security operatives in the state to enforce the directives without exception. Oyetola also placed a ban on all social clubs, hotels, departmental stores, supermarkets, event centers, and allied centers. They are to henceforth operate at half of their capacities and observe COVID-19 protocols. Meanwhile, the chairman of Osun Muslim community, Alhaji Mustafa Olawiyi, expressed the readiness of the religious body to adhere to the directive of the state government on the prevention of COVID-19 spread in those states.
Coming up, African stories. Uganda's flag carrier receives first Airbus aircraft. And later, international news. Brazil's COVID-19 death toll nears 200,000.
You are watching ANN.
Welcome back. This is ANN News. South Africa's health workers are now more anxious about the rising cases of coronavirus infections in the country, a situation that has been worsened by the fear over virus variants. They are also worried that their hospitals would be overwhelmed if the surging trend continues unchecked. Local health officials say the new coronavirus variant has been driving the second wave of infections in the country. The cases are increasing sharply every day. More than 42,000 infections were reported over the weekend, bringing the country's case load to nearly breaking the 1 million mark.
It is a genuine concern that we've got with the current rise in statistics, especially with this second surge, as it has already been declared. And one of our biggest concerns is the shortage of nurses, particularly, because we've already received reports and complaints of nursing 3 nurses being responsible for 9 ICU patients. And that's just the tip of an iceberg.
Listener, who is the Young Nurses in Daba Trade Union's General Secretary, shared the same concern.
Our worry is that what we experienced during the first wave, we are still going to experience it. At some point, our hospitals, our wards were full to the rafters. We were putting patients on the tents. What is going to happen now during the second wave, of which it is more dangerous and brutal compared to the first wave?
Africa's health system has been described as broken, and the government also admitted that there is an urgent need for significant reforms.
And with the added weight and the surge, the numbers that are rising right now, the healthcare system is most likely going to collapse. And to make matters even worse, we are now in a festive season where we've got all the trauma cases that are increasing.
Just to suppress the spread of the pandemic coupled with a new virus variant. Kenyan President Uhuru Kenyatta has urged the African Centers for Disease Control and Prevention to prepare harmonized COVID-19 protocols that will ensure participants are safe during African Union meetings scheduled for February next year. Kenyatta emphasized that the protocols will determine whether the African Union meetings will be virtual or physical, given the challenges caused by the COVID-19 pandemic. The Kenyan head of state spoke on Thursday during a virtual meeting of the Bureau of the Assembly of AU Heads of State and Government and chairperson of the Regional Economic Communities. The meeting was convened by South African President Cyril Ramaphosa to discuss modalities for holding the 34th ordinary session of the AU Assembly, the 38th ordinary session of the Executive Council, and the 41st ordinary session of the Permanent Representatives Committee of the AU. During the meeting, African Union Commission Chairperson Musa Faki Mahamat gave an outline of the AU meetings scheduled for next year that will also see the election of a new AUC leadership. African CDC Director Dr. John Nkengasong briefed the meeting on the status of the COVID-19 pandemic on the continent and recommended measures to prevent the spread of the disease during the AU meeting. These include limiting the meeting to 1 day, testing of delegates in country of origin and on arrival, as well as ensuring delegates strictly adhere to the COVID-19 protocols. Global airline industry has been facing tough times since the advent of the coronavirus pandemic. Some African airlines are nursing hope that things will look up in the industry soon. With that, Uganda Airlines has acquired its first Airbus aircraft, and correspondent Leon Sirianj reports.
Welcoming Uganda's latest aircraft, the Airbus A330-800neo touched down at the country's Entebbe International Airport last week. It's the first of 2 Airbus planes ordered by the Uganda government.
It's an amazing passenger experience. This interior was designed by Uganda Airlines to fulfill the needs of the airline in bringing that unique Ugandan hospitality to your passengers. The idea being that when a passenger in London enters the aircraft to fly here, they're already touching your unique hospitality.
The new aircraft adds to the fleet of 4 bombardiers already in operation. With routes in the region already running, the latest arrival will enable the airline to launch long-range operations. Non-stop intercontinental flights to the Middle East, Europe and Asia are being planned for.
From the beginning, the concept was that the airline would be developed in 2 stages. The first stage being the regional operation with the CRJ 900. And then once the African market was established with the routes to other African countries where we can collect people and bringing them into the hub in Entebbe, then we'll bring in the A330s to travel intercontinental.
Uganda revived its airline industry last year after a 2-decade lull. The government is aware of the turbulence in the airline sector caused by the COVID-19 pandemic and says it will not be throwing caution to the wind.
As government, we have a clear sense of the direction we have designed to take in order to ensure that our new national airline is successful and does not suffer the problems of the previous national carrier.
The government hopes the growing number of aircrafts will facilitate better trade and tourism. The second Airbus is expected in January 2021. And while current limitations on travel because of the COVID-19 pandemic may give the aircrafts a slow start, the airline says it's optimistic with its projections taking full flight by mid next year.
When we return, international news. Brazil's coronavirus death toll nears 200,000. And later, sport. Roger Federer to miss Australian Open.
You are watching ANN.
Susu is fine. No, she's not crying, oh. But we are watching cartoon. Ask grandma, I'm the one that used to take care of Yabo that time. Take your time.
They cry, oh, daddy, oh, daddy, oh.
I will call you back. Your daddy is calling.
Explore without limits. Turn it up on MTN, the reliable data network.
Everybody say.
Welcome back. This is ANN News. France has started its long-expected vaccination campaign on Sunday morning, with a 78-year-old lady being the first across the country to receive a dose of vaccine, a milestone move seen by locals as saving the country from trapping further into the pandemic. The woman was a former housekeeper and now resident of the long-term care unit of a hospital in North Paris. French President Emmanuel Macron tweeted minutes after the vaccination campaign officially kicked off to hail the new weapon against the virus, while noting that the vaccine will not be compulsory. The French government has also worked out a gradual roll-out plan to access citizens for COVID-19 vaccination on a voluntary basis and free of charge. The vaccination campaign is seen as a window of hope for containing the surging infections coupled with emergency of new cases of the coronavirus variant detected on the French soil. After 2 infectious coronavirus variants were detected in the United Kingdom, the country has strengthened its anti-epidemic measures nationwide. On December the 14th, the UK found the first coronavirus variant, which is believed to transmit more easily among people. 2 days before Christmas, Britain discovered another new coronavirus variant. The British government said compared with the first one, the new variant spreads faster and is highly mutated. Faced with such serious conditions, London and parts of England have been placed under Tier 4 restrictions since December the 20th. The government's Scientific Advisory Group for Emergencies has urged all citizens in England to lift their restrictions to the highest level. Scotland and Northern Ireland, which can decide on their own, have also imposed more stringent measures since Boxing Day. The World Health Organization says the first variant detection in the UK has also been found in Australia, Denmark, Italy, Iceland, the Netherlands, Germany, Canada, and Japan. Brazil will celebrate the end of the year under a strict quarantine in much of its territory as the pandemic situation in the country has remained harsh. It has been 10 months since Brazil discovered its first case of COVID-19, and the pandemic has caused 7.5 million infections and more than 190,000 deaths in the country. The terrifying figures have placed Brazil as the world's second in the number of deaths, only behind the United States, and the third in the number of infections, after the United States and India. In recent weeks, the daily death toll in Brazil reached 1,007 times, back to its level in June and August, and forced several states and municipalities to tighten restrictions and even adopt massive confinement. Major cities such as Sao Paulo, Rio de Janeiro, Salvador, and others have cancelled their traditional New Year festivals, and many have decided to back out of their planned virtual celebrations in a gesture of respect for the victims. America's top infectious disease expert, Dr. Anthony Fauci, has expressed concerns about a huge risk of another COVID-19 surge as travel by air and other public transportation across the U.S. has entered the peak period during the holiday season. Statistics reviewed by the U.S. Transportation Security Administration on Saturday shows more than 1 million passengers have so far traveled by flight across the country. The number of travelers remained high over the past week, despite warnings by the U.S. Centers for Disease Control and Prevention for people to avoid travel during the holiday season. Some medical experts are worried that an increase in the number of travelers will lead to a rise in COVID-19 infection and further worsen the spread of the virus across the country. Director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, said on a CNN interview, COVID-19 cases might further surge after the holidays based on current attitudes. Dr. Fauci further said the U.S. has witnessed a sharp increase in COVID-19 cases as additional travels and gathering during the holidays puts more pressure on the medical system, which might lead to a worse situation in the following weeks.
Up next, sport. Roger Federer to miss Australian Open. Please stay with us.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News in Sport. 39-year-old Swiss and six-time champion Roger Federer will miss the Australian Open for the first time in his career as he continues his recovery from a knee surgery. The 20-time Grand Slam winner has not played since January after he went through 2 different surgeries. He hoped to return at the delayed Australia Open, which starts in early February. The tournament director, Craig Tilley, reviews there is not enough time to get himself prepared. Federer has played in the Australian Open 21 years in a row. Manchester United manager Ori Solskjaer says the club intends to extend striker Edinson Cavani's contract. The 33-year-old striker joined on a 1-year deal in October with the option of a further year. He has started only 1 Premier League game but has scored 3 goals in 8 games. Solskjaer says he expects a new deal to be agreed. That is it on news this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatoji. Have a pleasant evening.